Travel is more than just ticking off countries. It's about the people, the culture, the food, the moments. I'm Pippa Hudson, and on Wonder the World, I invite you to join me every week as we explore destinations both near and far, with the help of fellow adventurers who share their unique travel stories. Listen to my podcast wherever you get them.
Thabo Shole Mashao in for Clement. We're together till 12. Great having you with us, and we're coming to you live from Century City Conference Center. This is on the backdrop of the Sustainable Infrastructure Development Symposium South Africa 2025, which is brought to us by Infrastructure South Africa. Amazing conversations that we've had, and we continue with another one shortly that truly affects so many people. And it's understood that globally, nearly 1 in 3 adults is hypertensive. And it's also said that men under the age of 50, many of them are showing slightly higher rates than women. And South Africa, a country, mirrors this global trend with rising cases linked to lifestyle factors such as poor diet, lack of exercise, stress, and high rates of obesity. I was just saying to myself the other day that I truly don't want to have meals after 6:30 anymore, because after reading some of the things that I read, which I should have known for some time, I thought no more. I'll just take it easy. But this is not advice to anyone, by the way. I'm just telling you about me. Don't take me to court and say I advise people on nutrition and any of that. I'm not doing that. I'm telling you about me as we're about to have this very important conversation on health and wellness. And today we are looking at hypertension in South Africa.
Join us.
Let's walk the talk.
This is 702.
It's also known as the silent killer. It's commonly known as high blood pressure amongst many of our communities. It's actually hypertension. This typical killer shows no symptoms until significant damage has taken place. So as a result, it takes many people off by surprise. Dr Mosima Mabunda, Discovery Vitality's Chief Clinical Officer, joins us right now to touch on hypertension. Doc, thanks for your time. Welcome to 702. Good morning to you.
Good morning, Thabo, and good morning to your listeners. Thank you for having me and for dedicating time to raise awareness about hypertension, as you said, the silent killer.
And thanks for making time, Doc. These conversations are very, very important because unlike some obscure story out there of controversy in politics, these are in our homes. They affect every single one of us directly or otherwise. We take it for granted that every single person knows what hypertension is. And it's not truly the case, is it? Do you want to break it down for us in layman's terms, Doc?
So I actually think that's a good place to start. And maybe to provide context to the listeners to say, why are we talking about hypertension specifically today and specifically in this month? We recently commemorated World Hypertension Day 2 Saturdays ago. And the month of May generally across the world is used to raise awareness, to drive people to go and screen and know about hypertension. And we'll get into why. So that's why there's a concerted effort today and in the month of May around raising awareness about hypertension. So a simplistic way that I would try and explain what blood pressure is, hypertension, similarly blood pressure, is think about it as the pressure of your blood pushing against the walls of your blood vessels when your heart is contracting, right? So the concept of blood pressure is not abnormal. It is normal. When we now say it is high, that's when we start to have concerns, and you might end up being diagnosed with hypertension. And the reason we get concerned when the pressure in your blood vessels is high is it can lead to serious health problems such as heart disease, stroke, and kidney disease if left untreated. And the interesting thing about high blood pressure and hypertension, and you touched on this, is many people who have it don't know, right? Because hence it's termed the silent killer. It is not immediately apparent that you can say, oh my God, I actually think I have hypertension, let me go screen. When many people typically find out, it is sadly when they have complications. Hence the importance for us raising awareness and encouraging people to screen. So that's one point that I think is important to raise and provide context as to why we continue to raise awareness. And the second thing is there is a myth based on historical trends that this is a disease for people who are older. I'm young, I don't have to worry about it, I'm less than 40, etc. I want to dispel the myth to say if you're an adult, it is in your best interest to be clear that you know your blood pressure, because we are starting to see trends not only globally but also in South Africa that individuals who are less than 40 actually do get high blood pressure and would need treatment. And those individuals don't typically interact with their doctors regularly, and it can be missed. So the screening message and awareness message applies to everyone across the board, the importance of knowing whether you could possibly be at risk.
Let's spend some time, if you will, Doc, on something that may be elementary to those who are closer to the story, but to many South Africans clearly may not be as obvious. The symptoms thereof, because you may have one and not have the others, and assume that all is okay. And of course, as you've already cautioned us, we must go out and check ourselves in order to be completely sure. Share with us a bit about the symptoms, and please don't hesitate to delve into them a little bit.
So I think that's an important question that people typically, when we think of an illness, we think, oh, I'm going to have something that alerts me that I have a condition. Unfortunately, blood pressure is not like that. Some of the symptoms that would manifest when someone has complications are not necessarily unique to blood pressure. You know, you'll hear people often saying, oh, do I get chest pains or do I have a headache, etc. It is very difficult to rely on symptoms to detect risk. So I want to discourage individuals from relying on symptoms as a proxy to say, do I have high blood pressure, but to get into the habit of screening regularly. But in the same vein, regardless of the disease, if you have any symptom or any physical symptom of anything, the best way to address it is to engage with a clinical professional to find out what it is, because many of the symptoms are shared across conditions. But as it pertains to high blood pressure, your best bet is to screen on a regular basis to make sure that you are aware of your risk and you can see as it tracks. And what we find is, as Thabo, the beauty about screening is it provides an education opportunity, because there are things that individuals can do to reduce their risk of high blood pressure. And many of them are lifestyle driven, which touches on the work that we do in Vitality, that we know that high blood pressure contributes significantly to causes of death. It's one of the leading risk factors for death. It's in the top 10. However, there are measures that individuals can take to reduce their risk of hypertension. Screening is important because if you do have high blood pressure, you are connected to appropriate treatment and medication with your clinician. But on a daily basis, things that we always emphasize is, in addition to actually screening, on days like this, it's important to remind everyone that you certainly can prioritize your diet and eating healthy, which you touched on, to make sure that you reduce your risk. And acknowledging that diet is complex. My sense is, if I look at programs like Vitality, we simplify that understanding of what is healthy or not by using the healthy food catalog. That if anyone walks into a Checkers or a Woolworths, when you see a pink V sign, you know that is something that has been vetted by dietitians, that aligns with guidelines, as an example, and there may be many others. But understanding what is healthy and then learning how to prepare healthy, yummy meals, and eating healthy food, you reduce your risk of high blood pressure. You wanted to interject there, Thabo?
Yeah, I did. Before I lose this, and apologies for the doc, you talked about something very important, screening regularly. I wanted you to give us a definition of regularly. How often is that?
So I'll tell you what we incentivize in the Vitality program. So in the Vitality program, we're trying to get our members to build healthy habits, healthy clinical habits, and we incentivize them for that. And the primary reason is, when you get into the healthy habits, we ultimately see that it is easier to remember. Individuals tend to adhere to healthy lifestyle behaviors, and ultimately they detect risk early. So in the Vitality program, we incentivize our members to go for their Vitality health check annually as a principle, because not only do you get to know your blood pressure, but that is also an education opportunity for the nurse practitioner or for the GP, if they went to a doctor who's with them, to actually educate them around healthy lifestyle behaviors and other risk factors. But having said that, I find that an easier way to do it, especially things like high blood pressure and weight, is to use every interaction with a healthcare professional to screen your blood pressure. If you see a doctor as part of assessing and measuring your vitals, doctors have got blood pressure machines in there. It is absolutely acceptable for you to actually say, every time I go to a doctor, I will ask for a BP measurement, to be opportunistic about those interactions as well. So I think generally that's what I would recommend. And the reason I recommend that is it allows you to get into a habit of saying, I will check, versus relying on memory.
Sure. We'll come back and continue with the good doctor, Dr Mosima Mabunda, Discovery's Vitality Chief Clinical Officer. And as we discuss hypertension, how it affects all of us, please feel free to participate, send your questions and your thoughts, because this silent killer affects so many people out there. It could be that you have a question for the good doctor and you want to pose it. Do so on 011-883-0702, 011-883-0702. Alternatively, send a voice note to 072-702-1702.
702
Let's walk the talk on 92.7
and 106 FM.
We're talking hypertension. Welcome back. This is Health and Wellness. Thabo in for Clement. Together till 12. It's 11 minutes to 12 o'clock. Without any further ado, let me just go straight to your questions and I'll go to a call. The text messages came on 072-702-1702. The other one says, do the conditions of your arteries affect your BP? Doc, please note that. And there's another question that says there's a growing number of African males in their teens and their 20s with hypertension. We say them hospitals. I think we take them to hospitals is what they wanted to say. We take them to hospitals with complications such as kidney failure when it's too late. Diet and inactivity are a contributing factor. They've never seen this because they think they're not at risk, coming from Mpo's a dietitian. Hi Thabo, I would like to know if it's possible to get rid of hypertension, or once you are on the medication, it's for the rest of your life. Dr Mosima Mabunda, Discovery Vitality's Chief Clinical Officer. Over to you.
Firstly, let me just appreciate the comments that came through, because it means that your listeners are engaging with the topic, which is precisely the objective of this conversation. I quite like the question around whether hypertension is a short-term or long-term condition, and we didn't touch on that earlier. So hypertension is classified as a chronic condition, and what that means is it is a lifelong condition. Unlike if you get an infection or a flu, you can treat it and it's done and dusted. But the good thing, though, about hypertension is, though it is a lifelong condition, it's been demonstrated that you can control it with medication if you adhere to those medications. So a good number of people that are adherent to blood pressure medication are able to lead normal, healthy lifestyle and reduce their risk of complication. So a part of raising awareness is actually to encourage individuals that there are things that you can do within your control to reduce the risk. But not only that, if you do get diagnosed, it's actually not the end of the world, because we want you to actually get on treatment that will help normalize your blood pressure as much as possible. And it is by controlling that you actually reduce your risk or avoid the likelihood complications of high blood pressure, which is what ultimately leads to disease and death. And I mean, I always cite this example that, like, my mom is a good example, where she got hypertension probably in her 30s. And she's been well controlled, and she has not even gone to multiple medications. One medication, well controlled, exercises regularly, has been fortunate enough that through that control and regular check-in with her clinician, has managed to delay the complications associated with the condition. And I think many clinicians who would counsel our listeners on hypertension medication can attest to that. And I just want to touch on this because we spoke about awareness, and that's why we're doing this, for people to screen. But there is another challenge where there are individuals that have hypertension that are not adherent to their medication. And I think it would be a missed opportunity for on highlight efforts that are underway to try and drive that, because those are high-risk individuals where we know that their high blood pressure is high. I know that there are various interventions in place, but specifically in our world, an example of how Discovery Health is trying to support that so that these individuals can avoid complications is through the personal health pathway programs, where these individuals are financially incentivized to actually adhere to their medication, because we know that is an impactful action that will help normalize their blood pressure and reduce risk.
Let's go quickly to the calls. 011-883-0702. Museb Jaji, apologies for butchering your name, Museb Jaji, from Rudipot. Please correct me, and you're welcome to give your comment.
Yes. I was one of the persons who was diagnosed with high blood pressure, but I had low blood pressure. Is it possible to help me to have both? Please ask doctor, and I've got a comment. I've got a suggestion. I've got something to say.
Yeah, don't go away then.
Okay.
Sure, don't go away. Please stick on the line. Doctor?
So if I heard the question correctly, Mosebe is asking if it's possible to have two diagnoses in one, a diagnosis of low blood pressure and a diagnosis of high blood pressure. Maybe let me start by prefacing that blood pressure in itself is very variable during the day. Depending on when you measure it and whether you had been running or had eaten, etc., your bladder is full, your blood pressure would vary. So at any point in time, I remember last week when I ran down the stairs and I measured my blood pressure, it was high, but after I had rested, it would settle down. So a single measurement at a point in time is not a diagnosis of high blood pressure, and I suspect that's what Mosebe is talking about. To get a diagnosis of high blood pressure, I would encourage Mosebe to go to the healthcare professional who would measure it appropriately and validate it. And they usually would do a series of measurements in one day and most likely repeat them to get a formal diagnosis of high blood pressure. But I don't want to guesstimate, but I just wanted to highlight to Mr. Vedi that it is not uncommon that you can walk in, depending on your individual circumstances and when you go in, or whether the cuff is calibrated or not, your blood pressure would vary. But from a diagnosis perspective, it's more than just that single measurement that you will get in that one time point, and you would need to go to your GP to actually validate that.
Dr. Mosima, we have about 30 seconds remaining. Anything else that we've left out? And how do we then try to do our best? Of course, we can't prevent everything, but how do we try to do our best to keep a healthy lifestyle?
So I would say if you don't know what your blood pressure numbers are, I would encourage you to screen. If your family doesn't know, I would encourage you to get them to screen. That's the one thing you can do to save their life. And if you know your blood pressure regardless of risk, try and commit to engaging in healthy lifestyle. Pick one: diet, nutrition. Start somewhere, start small, and build onto it. Because by engaging in healthy lifestyle behaviors, you will reduce your risk. And simplistically, if you're a Vitality member, just leverage the program and the assets that we have to help you lead a healthy lifestyle to reduce your risk of high blood pressure.
Thank you so much. Really appreciate your time, Dr. Mosima Mabunda, who is Discovery Vitality's Chief Clinical Officer.